Hello, this is Mr. Neil Reiter, consultant audiologist and director of ClearWax. Thank you for joining me in another demonstration video of our recently developed waxscope, which is due to be available to purchase from early autumn 2022. So if you're interested and you want to learn more about the waxscope, please do email info@clearwax.co.uk and we can add you to our mailing list. So we have a patient here who attended with bilateral fully occluding earwax with sizable earwax plugs in both ears, and we're just starting off with the right ear. Now the patient has got a narrow ear canal entrance, so I'm just using the smallest of our 4 speculum sizes, which is a 3.5mm, and this attaches to the wax scope directly, and of course it's single use, so once used it's disposable, and you attach another speculum for your next patient. And the sizes that we have are, as I said, 3.5mm, which is the one that I'm using at the moment, 4.25mm, 5mm and 5.75mm for the extra large ear canals and mastoid cavities. So I've just put some olive oil spray in here just to change the consistency and bind the wax plug together, and you can see I'm getting a much better suction grip, and I'm just retrieving this wax plug out of the ear. The entrance is a bit narrower, so as the speculum is withdrawn from the ear, the entrance does narrow a bit and closes upon the wax plug, kind of seizing it and trying to trap it inside the ear, but we just managed to wriggle this out. So I'm just going to dilate the ear canal now using the speculum. We're going to visualise the eardrum. Just going to get it in focus. You can see a nice healthy eardrum there. Just having a good examination of the whole ear. And so this is the patient's left ear. The wax in this ear was a bit stickier, at least the surface was. And again, just near the entrance, I'm just going to lift this off the base of the ear canal. But it was a bit too glutinous and sticky, so I decided to put some olive oil spray straight away, just using the speculum there to dilate the ear. This is probably where some people will find it difficult to use our iClear scope, endoscope, because you're having to dilate and stretch the ear using the endoscope itself, and at the same time visualize the wax and use your other hand simultaneously to remove the wax. And it was just stretching and straightening the ear that some people found a bit difficult. Not everyone, but some people found that a bit difficult to use with the iClear scope. And that was the reason why I decided to develop the wax scope as well as a complementary alternative device to the iClear scope. And with the wax scope, it's a bit like when you're using loupes or an ENT microscope. You have a speculum that dilates the ear canal, and then you can fully visualise the contents of the ear. And instead of holding the speculum in place using your non-dominant hand, as you would do with loupes or an ENT microscope, the speculum here is attached to the end of the wax scope. And it's like a clip-on, and we have an open working channel and a slit at the top as well, which enables the instrument to be inserted into the ear at a higher angle, and that helps not only improve the optics inside the ear, because it's not necessarily obliterating, obscuring the whole view of the instrument if it came from directly through the centre of the speculum, but it also provides more manoeuvrability. Now, just like the patient's right ear, but more so in this ear, this wax plug's got trapped near the entrance. We've loosened it, we've mobilised it. Therefore, I'm now going to insert a Jobson horn, and this is where the wax scope has additional advantages, because it's just not microsuction. With the wax scope, you can use the full range of ENT micro instruments. So here, you can see how we're using the Jobson horn to get in and behind this wax plug and slowly bring it forward. So remember, this is a smaller speculum, so even with a small speculum, there's enough space, manoeuvrability to insert all instruments. So this is the patient's left ear, again quite a narrow ear, but even then we've got a great view. Just adjusted the focus slightly, you can see all the blood vessels and capillaries to the back part of the ear canal there, and the eardrum. Hello, this is Mr. Neil Reiter, consultant audiologist and director of ClearWax. Thank you for joining me in another demonstration video of our recently developed wax scope, which is due to be launched in early autumn 2022. So if you're an ear care professional who wants to be added and join to our mailing list to find out more about the wax scope, please do email info@clearwax.co.uk. We have here a patient with a very narrow ear canal, and they had used a cotton bud and wedged this very dark wax, as you can see, right up against the eardrum. Now, because of their narrow ear, and it is also quite a bendy ear, the second bend's quite prominent, you can just about see it on view on the right hand side of the screen. I'm using our smallest speculum, size 3.5mm, to dilate the ear canal. Here's another a view of how narrow the ear canal is. So I've just taken the speculum out, and the ear canal's completely shut and narrowed. So I've just gone back in with the speculum. I've just dilated the ear canal wide open. I've adjusted the focus because the more lateral part of that plug I've managed to extract and bring forwards, but there is still quite a lot more wax deeper in the ear. So again, it's just getting trapped at this entrance. So once more, just stretching the ear canal wide open. And it's almost like pellets, this wax. It's quite hard and dry, and It's very dark, so it's been there for a while, it's oxidized, and the day before they had used a cotton bud and they just managed to push it deeper in the ear. So again, I'm just stretching the ear wide open, and then adjusting the focus because we're trying to visualize the wax that's still on the eardrum over here. You can just see the eardrum appearing on the left-hand side. So it's just in view, and it's just trapped in the inferior and anterior recess. So I've got a good suction grip there. I'm just bringing this out now, and I think it gets trapped again at this entrance where it's really narrow. So I'm just going to stretch the entrance wide open again, adjust the focus, and then slowly bring this out. There we are. So I think that's all the wax. You're just going to go back in and just going to visualize the eardrum. So we got a few crumbs of wax in there. We're not too interested or bothered by that as such. Just going to adjust the focus. You can see the handle of malleus, just having a good nosy around the eardrum so it's all visible. And then just having a quick sneaky view in the patient's left ear, which is completely clear. You can see it's quite a narrow ear.